All eyes now are on what happens after the 1st of June. But the fact is that the numbers are increasing of COVID cases as well as mortalities, even as recovery rates are also increasing. But would you believe it, that therefore the focus is on hospitals. Now, hospitals means, some say, high fees, particularly in private hospitals. Take a look at this. There are some hospitals that are even charging you possibly 1 lakh rupees just for N95 masks and PPE kits. That might sound bizarre, but that's happened in several private hospitals where COVID care centers have been established. What we wanted to find out is what will be your corona bill. If tomorrow you have to go to hospital, what will you be spending on? India Today has gone and dug out case studies where a major chunk of the hospital bills in private hospitals now comprise of PPE kits and masks. Take a look at today's special report.
Private hospitals, the go-to option of the middle class. They account for over 60% of hospital beds in India, according to government figures, and are set to play a big role as the country is set to enter a decisive phase in the coronavirus fight. But how much does it cost to get COVID treated in a private hospital? India Today tracked down patients who underwent treatment in the private sector to piece together a cost analysis. A Mumbai-based man who does not wish to reveal his name tells us 50% of his hospital bill was attributed to PPE kits and N95 masks. And to his horror, he found out his insurance does not cover those. Let us now break it down. The total bill came to 2.8 lakh rupees. And the money spent on PPEs and masks, 1.4 lakh rupees. All paid from his family's pockets.
मैं कोरोना पेशेंट था। मैं खुद ही प्राइवेट हॉस्पिटल में एडमिट हुआ था। मैं 19 दिन एडमिट रहा, लेकिन डिस्चार्ज के टाइम जब भी मैंने बिल देखा तभी मैंने देखा कि उसमें 50% एक्सपेंस तो खाली पीपीई किट और N95 मास्क में ही हुआ था, और मेरा मेडिक्लेम भी था। जब भी मैं डिस्चार्ज होने के बाद घर आया तो मैंने कंपनी के पास रिम्बर्स के लिए मेरा क्लेम रखा, तो उसने पीपीई किट और N95 मास्क का क्लेम लेने से ना बोल दिया। उसने बोला कि उसका हमें आपको पैसा नहीं देंगे।
Surendra's brother was treated for COVID-19 in a private hospital. For the first 2 days, the private hospital charged them 4,300 rupees per PPE kit, and for the rest of the week, the price went up to 8,900 rupees per kit, denting their pockets by 80,000 rupees just for PPEs over 9 days.
पीपीई किट इन्होंने 11 तारीख से लेके 19 तारीख तक जो यूज़ करी है, 9 दिन की पीपीई किट यूज़ जो करी है उसका बिल लगा रखा है 70,900 रुपये। इनकी जो किट की वैल्यू है, पहले 2 दिन तो ये लगाते हैं 4300 के हिसाब से, उसके बाद ये 8900 रुपीज़ के हिसाब से किट लगाना शुरू कर देते हैं बिल में।
A family in Chennai was charged 1,75,000 rupees for 9-day hospitalization, of which 33,000 rupees was for PPEs. They have now filed a complaint with the hospital.
Can you explain to us what exactly is the charges that has been put on the treatment that was given to your family member?
We have had the patient admitted in the hospital for like 8 to 9 days, and the bill that came in was for like 1,75,000. And what was shocking was that, you know, the PPE kits were charged at 33,000, and the charges for the doctor, which they claimed as a specialist, was 51,000. So technically there is no specialist here. There's somebody who's probably a duty doctor who's go checking and coming back, and we were literally shocked with the kind of charges they were putting there. And also there was a lot of mistakes when they were claiming the insurance. They sent wrong details like twice, and our insurance was rejected.
As the number of COVID cases rose, health insurance came into demand. Between January and March, the industry showed nearly 25% jump in business. But what hurts COVID patients is the fact that many insurance policies don't cover the cost of PPEs.
PPE kits and N95 masks, they come under consumables. Consumable as guidelines are not part of the health insurance product. But now, because PPE kit and N95 are part of consumables, so it has gone from 10 rupees to 50 rupees. So that's the reason the entire bill, if it is 100 rupees, 50% is consumables.
We reached out to leading private hospitals in the country to understand what explains the billing. Max Healthcare responded. It cited a FICCI representation on COVID-19 costing, saying the average cost of PPEs per day is 10,000 rupees. PPE consumption varies from hospital to hospital. In COVID ICU, we expect consumption to be up by 8 per day. Leading institutions in COVID-19 fight mentions 20 PPEs are used per patient.
Patients and insurance companies are in a tug of war over hospital bills. While insurance companies are saying they are only following procedure, patients are the distressed lot because they are feeling a pinch on their pocket. On the other hand, experts believe that it is the right time for the government to intervene. Otherwise, we would see lakhs of patients across the country shelling out a bombshell on hospital bills because of COVID-19. This is Aishwarya Paliwal reporting from New Delhi with camera person Rohit Sharma.
Okay. Are hospitals therefore using PPE kits and masks to inflate corona bills is one of the questions I'm going to raise. I'm joined by Dr. Sujit Chatterjee, CEO at the LH Hiranandani Hospital in Mumbai, Prasoon Shikdar, Managing Director and Chief Executive Officer, Manipal Cigna Health Insurance Company, joining us. Appreciate both of you joining us. We have done, Dr. Chatterjee, a scrutiny of detailed bills of 6 COVID patients admitted in top hospital chains in Delhi, Mumbai and Kolkata private hospitals. 2 trends. Those with comorbidities ended up with heftier bills, and those with no specific treatment or drug available, the PPE of staff and the cost of drugs was the biggest variable. In fact, the PPE in particular, the amounts varied staggeringly from hospital to hospital. Are hospitals using COVID patients to inflate PPE bills, even mask bills, ICU bed bills, to make more money? Is there a profiteering angle here?
Well, Mr. Sardesai, I must be very frank with you. At this particular point in time, it's more of a moral issue that engages us in healthcare. And there's always this thing about profiteering, and hospitals are profiteering in healthcare. Look, there are costs which have to be borne by every hospital.
Yes.
And when we talk in terms of PPEs, then in that case, it depends on how the hospital beds are configured. Now, if you have a ward-type bed,
yes,
that means you have all the patients on a single floor, then in that case, automatically the design, the elegance of design of that hospital will see that there is only one team of doctors and nurses who treat patients. So therefore, you don't have to keep on charging patients for every PPE and an N95 mask.
My point though is, sir, why should the variation be from 5,500 in some hospitals to about 800 to 1,000 in the other? The wide variations in the PPE structure seems a bit puzzling.
But sir, the PPEs, at least for the state of Maharashtra, I can only speak about the state of Maharashtra. As far as we are concerned, the level of the costing of the PPEs has certainly been controlled. I mean, there is no big, huge variation from company A and company B. It's not that way at all. Now, a bill in Maharashtra or in Mumbai, for example, in my hospital, a 7-day stay in the ward, which we have declared as a COVID ward, would cost you anything between 85 to 90,000 rupees. But if they are using some high antibiotics and stuff like that, then of course the bill will go up.
Okay, I'm going to come back to you and press you in a moment, but Prasoon Shikdar, because part of the problem with these inflated costs in PPEs, or the fact that PPEs account for a large sum of the overall corona bill costs, are they covered by insurance companies? Is your corona care, my COVID care, being covered by insurance companies when it involves amounts like PPE kits?
No, Rajdeep, in a normal operating environment, as per the regulatory guideline issued earlier, PP actually falls under optional list of coverage items. Since it's a pandemic scenario and highly contagious nature of the virus, we are paying for the PP kits both for COVID and non-COVID treatments as of now. At least from Manipal Cigna Health Insurance, let me tell you, and as far as I know, from an insurance industry perspective, both for COVID and non-COVID, I think we have taken a moral ground and basically paying for the PP
even
kits.
if it is not specific, even if Mr. Shikdar is not mentioned specifically in my insurance claim?
Yes, as of now, as I said, that we are paying it. The severity of the COVID-19 outbreak has forced hospitals to make it mandatory for the health workers to wear protective gear, and rightfully so, Rajdeep.
Yes.
Including bodysuits, face shields, adding to the costs of patients as well as hospitals. What is making matters a little complicated for us, is the cost of the PP kits are not standard. Given the varying and unregulated cost of PP kits as of now, some bit of lack of standard protocol is basically what is hurting us. I just want to tell you that, the insurance industry, along with the hospital sector, along with a lot of industry body, the regulator, the General Insurance Council, we are in constant touch. And I'm pretty sure that, we will basically get into some kind of a standardization of the overall cost, not only for PPE, with some kind of an upper limit. And, if you can do that, then the customer suffering with COVID-19, when it gets a reinsurance, that the treatment is covered. And therefore, we are speaking to the hospital on a regular basis. And I'm pretty sure that we will come into some kind of an understanding of standardization of the overall COVID costs as well as the PP cost as we move along.
That's the word standardization, Dr. Chatterjee, I want you to respond to, because an order marked to the Indian Medical Association said it has been observed that private hospitals are using PPEs irrationally and overcharging for them. All private hospitals are directed to use PPEs only as per issued guidelines and justify the costs being passed on to the patient. Can there be a standardization, you believe? Is it possible really in the healthcare sector when it comes to COVID care?
But the standardization possibly they refer to as government approved. See, there are two organizations which can actually approve a PPE. One is that CITRA, the South Indian Textile Association, and DRDO. So therefore, if you buy something which has got a stamp of CITRA or the DRDO, the demands, then you've got something standard. So why don't you buy that?
So the reason I'm asking you this, I take your point, but the worry that many consumers are coming up with is that we've done a case study, a medical bill that in normal times would have cost 2.6 lakhs for a 6-day stay has risen to 16.4 lakhs for almost a month. The worry is that, for 15 days, people are paying in some hospitals as much as 16 lakhs. And many of these numbers that are being added up are these so-called incremental costs.
But Mr. Sardesai, I think we should take a deep dive into the billing, because there must be so many other issues which are far more expensive than the PPE, and we seem to stick on to the PPE.
No, I'm not picking so let's look at that. Room rent, of course, varies from 3,000 to 10,000. Per day consumables, 4,000 to 8,000. Drugs up to 13,000. Cost per day treatment for a positive patient in a non-ICU setup range was 14,000 to 32,000. So for a 10-day stay, that alone translates to 3.2 lakhs.
So, but then why don't you follow the Maharashtra model, where the Maharashtra government has said for the COVID period, your ward charges at 4,500, your 4,000, sorry. The charges for the ICU without the ventilator is 7,500, and your charges in the ICU with a ventilator is 9,000, and this is because of the COVID period. So I think this is fairly standard, isn't it, sir?
No, because the Supreme Court this week has also said that maybe that the entire COVID treatment needs to be looked at differently and regulated. Do both of you agree? A very quick remark from both of you, Mr. Sikdar, that it needs to be regulated in some form and an upper cap should be fixed. Do you agree? Upper and lower cap?
No, so Rajdeep, I agree, but we have to also understand that the COVID-19 is a rapidly evolving situation, and our healthcare providers and the personals are doing a terrific job, I think, on the ground in helping India fight this battle.
Right.
With regards to the rising treatment cost, I have just a couple of points to make. It really depends on multiple factors, Rajdeep, such as the age, the immunity, the underlying comorbid condition, the stage of the progression of infection, so on and so forth.
Right.
All of these play a role and an impact the requirement of ICU stay, artificial respiratory support, high-end drugs, etc., and would vary on a case-to-case basis. It is impossible to really put up one standard rate for every kind of patient.
Okay.
So the care protocol followed typically incurs an incremental cost due to nature and criticality, as well as the longer length of stay. Somebody has to stay for 5 days, other person needs 13 days, somebody has to stay for 19 days.
Right.
So as an outcome, this leads to increase in cost of treatment, Rajdeep, with the kind of infrastructure required to prepare and isolate infected patients. Treatment in private hospitals will be a costly affair. I agree, as from an insurance industry perspective. But as an insurance industry, we are doing our bit to support our customers. Our role as health insurance, however, Rajdeep, is to safeguard our customers and also healthcare providers. And financial viability for our customers, hence, is indeed a concern. And then, because if there's an overcharge, and ideally it would get this variability factor out, we must actually have a standardized rate. And standardized rate for different kinds of patients, standardized rates for room rents, and Maharashtra is a live example of basically doing that. Not every state has basically done that. Because if you could do all this, then it takes away a lot of anxiety out of the equation, and suddenly everything gets simpler, Rajdeep. Healthcare providers to focus on extending care and safety of themselves and the patients, and for us it will be focus of ease and well-being for our customers.
You want to quickly, 30 seconds, Dr. Chatterjee, standardization, is that the way forward?
Standardization, sir, to a certain extent, but I disagree with it completely, in the sense that you can't have it for, one size fits all. Because there are high-end drugs like immunoglobulins, meropenem, parenteral nutrition, tocilizumab. All these drugs will cost a lot.
Okay.
So therefore, you can't just have a standardization saying that this should be the upper limit. What if you cross the upper limit, sir?
Okay.
So we are doing a fantastic job. Believe you me, sir, we are shoulder to shoulder with the government doing a fantastic job. And that's where we are. This is a war, and we will win this war, provided we all put our shoulders to the wheel. So therefore, don't think that just because we are private hospitals, we are onto a profiteering spree. We are not.
We'll leave it there. We'll take your word for it. We will keep coming up with stories and showing bills that may be seen as excessive. But for now, Dr. Chatterjee, Mr. Sikdar, I appreciate you joining us and telling us that you hope that a customer will not be, you're promising us that you will get insurance and will not be overcharged. Let's take a break. When we return, we're going to turn to a day in the life of Corona warriors. That's coming up when we return.
Hi everyone, Preeti Chaudhary here. Hope you like this video. For latest news and analysis, like and subscribe to the India Today YouTube channel. And don't forget to press the bell icon to stay updated. Thank you for watching.